Maddie Green, and we're going to be talking about treating traumatic brain injuries with hypothermia. Some background information first is that a traumatic brain injury occurs when there's a blow to the head that disrupts normal brain function. This happens in about 2.5 million people per year. 50,000 of those result in death, and 80,000 result in having a permanent disability. And when a patient is first brought in with a TBI, they are given a ranking according to the Glasgow Coma Scale. And that coma scale takes into account motor, verbal, and eye-opening responses. If the score is under a 9, it's considered a severe TBI. Current treatments include releasing pressure on the brain, repairing fractures, and removing blood clots from the brain. So the question that this study is going to address is, does treatment with hypothermia promote recovery of a traumatic brain injury? This study actually took place in 6 different countries, and they're listed up here, with 510 participants. There was a 1-to-1 ratio between the patients that received the hypothermia treatment and those who just received normothermia, which is normal treatment. The ages ranged from 18 to 60, with the median age about 34, and most of the participants were male. The hypothermia conditions were started within 3 hours of the injury, and that was done by injecting the patient with 2,000 milliliters of ice-cold saline and then surface cooling wraps on the patient so that it lowered their body temperature to 33 degrees Celsius, which is about 93-ish degrees Fahrenheit, and that lasted for 72 hours, and then they raised the temperature. They stopped the study if their intracranial pressure rose or if hemodynamic instability occurred. And the results of the study actually showed that there was no difference in mortality or recovery between the normothermia and hypothermia conditions. However, there was a greater risk of pneumonia in those hypothermia patients, about 70% compared to 57%. But the results ended up not supporting the hypothesis that hypothermia can be used as a treatment for traumatic brain injuries. And what's significant about this is that there's actually been a lot of studies done that have shown that this has worked, and a lot of those were done in like Asian countries or lowering the temperature to about 31 degrees instead of 33, as well as varying the times. So some flaws that I noticed were that since it was done in 6 different countries, there was 14 different care sites. So there could be some changes between the care that they received at one hospital compared to another, as well as some studies compared their ages, their Glasgow Coma Scale, compared their score compared to normothermia and hypothermia, and found that there was differences there. So that could be used as a future study. Another flaw, though, would be that there are people in the normothermia group, there was more of them than there was hypothermia patients. I kind of just addressed a lot of these, changing the temperature, comparing the test results to some of those Asian countries that have had positive results, and those Glasgow Coma Scale differences. Overall, though, before I get to citations, is that I think that this is important because we don't really know. There's still a lot to learn about this treatment and whether it is effective, and it can be really helpful, though, for people who have suffered from traumatic brain injuries to be able to have a recovery and result in greater mortality, greater survival rates, and faster recoveries. And that's all. Citations.